In this video, we are going to talk about the mechanical ventilator. So, generally, in which condition mechanical ventilator is used and which are the type of modes which are used into the mechanical ventilation. Okay, so first we see what is a mode of ventilation. So, generally, it is the pattern of breath delivery to a patient. ओके कि पेशेंट को जब भी हमें ब्रीथ प्रोवाइड करना है तो मोड हम यूज़ करेंगे. ओके, सो इट इज़ अ पैटर्न ऑफ ब्रीथ डिलीवरी टू अ पेशेंट. देन विच आर द इंडिकेशन ऑफ वेंटिलेटर. Indication, that means कि in which condition patient require a ventilation support. So in that there are two type of indication. First is clinical indication and second is mechanical indication. So first we see a clinical indication. In that, patient with ARDS, that is acute respiratory distress syndrome patient, in that mechanical ventilation is required. The patient of pneumonia, asthma and COPD, okay, in this patient also the mechanical ventilation is used. Pneumonia, asthma and COPD, that means chronic obstructive pulmonary disease, in this patient the mechanical ventilator is adequate. Third is respiratory muscle weakness patient, or we can say a paralysis of respiratory muscles. That type of patient need a ventilator. Head injury patient. If patient is in the coma state or patient is unconscious due to the traumatic brain injury, in that condition ventilation is helpful. Then CVS, renal and CNS system involvement disorder or any condition. CVS, that means cardiovascular system, renal system and the CNS, that is central nervous system condition. It's in that the indication of ventilator is useful. Then second indication is mechanical indications. So that is first one, RR is greater than 35 per minute. That means के respiratory rate is more than 35 per minute. Then inspiratory pressure is 20 semi H2O. Okay, that means inspiratory pressure is less than 20 semi of H2O. In that condition also mechanical ventilator is required. Then vital capacity is less than 10 to 15 liter per minute. So in this type of criteria the ventilation is required. Now we see the type of ventilator. That means total two types. First is invasive ventilator and second is non-invasive ventilator. So the name suggests invasive means patient में हम tracheostomy के through वेंटिलेशन प्रोवाइड करेंगे एंड नॉन इन्वेजिव मीन्स जनरली हम फेस मास्क के थ्रू ही पेशेंट को वेंटिलेशन प्रोवाइड करेंगे. So see, invasive ventilator is the first one. Invasive ventilator, the endotracheal intubation through mouth or nose and tracheostomy is done into the patient. Non-invasive, that is second type, is ventilatory support without intubation. Okay, there is no requirement of any intubation. Generally we only use a face or nasal mask for the provision of the oxygen delivery to the patient. Okay, so with the use of face or nasal mask can be used as an alternative to invasive ventilator. Okay, if the patient is not suitable for invasive ventilator, so it's alternative. In that we use a non-invasive ventilator also for provision of the ventilation to the patient. Then which are the modes of ventilator? Okay, modes of ventilator. So in that there are two types, that is invasive ventilator and non-invasive ventilator. Okay, and subtypes is in invasive ventilator there are two mode, pressure mode and volume mode. In pressure mode the PCV and PSV mode is come. In volume mode there are total four type of mode, that is AC control mode, CMV mode, IMV mode and SIMV mode. We see one by one in next. What is PCV? That is pressure control ventilation. Pressure control ventilation mode. PSV, that is pressure support ventilation. Pressure support ventilation. AC control, then CMV. CMV, that is control mandatory ventilation or continuous mandatory ventilation. Then IMV, that is intermittent mandatory ventilation. Generally mandatory, that means ki control. Okay, so intermittent mandatory, and CMV, that is a continuous mandatory ventilation. SIMV, that means synchronized intermittent mandatory ventilation. Sometimes the SIMV is used with PSV. Okay, so that is known as combination mode. Okay, then second type, non-invasive ventilator. In that subtype is positive pressure and negative pressure type of ventilator. Positive pressure, in that there are total two, CPAP and BiPAP. CPAP and BiPAP. CPAP, that means continuous positive airway pressure, and BiPAP means bi-level positive airway pressure. Continuous positive airway pressure and bi-level positive airway pressure. In negative pressure, the example is iron lung. Now, what is negative pressure ventilator and positive? So, negative pressure ventilator, it is rarely used. It resembles a normal lung mechanics, and it's help to patient with generate a negative pressure into a one tank. Okay, see in diagram here, one tank is shown. In that uh, patient is in the lying position, and the negative pressure can generate into the machine, and it's help to a patient's lung for the ventilation. Nowadays it is not very useful. Then we see what is positive pressure ventilation. That means the ventilator moves air into the patient's lung at positive pressure, and at the end of inspiration the ventilator stop delivering a positive pressure. Okay, at the end of inspiration, the ventilator is stop the delivering a positive pressure, and it is most commonly used nowadays. The ventilator. Okay, we see that is first of all we see about the what is mechanical ventilation and modes of ventilator. That means it is the pattern of breath delivery to a patient. Indications, that is clinical and mechanical. Okay, mechanical and clinical. In clinical, ARDS, pneumonia, asthma, COPD, respiratory muscle paralysis patient, head injury patient, CVS, renal and CNS system involvement patient. In mechanical indication, that is respiratory rate is more than 35 per minute, inspiratory pressure is less than 20 semi H2O, and vital capacity is less than the 10 to 15 liter per minute. Then we see a type of ventilator, that is invasive type and non-invasive type. In invasive type, that means with the tracheostomy or endotracheal intubation, we can provide a ventilation to the patient. In non-invasive type, there is no need to intubation. Without intubation, we have to provide a ventilation to a patient with use of face or nasal mask, and it is alternative procedure of the invasive ventilator. Then we see a modes of ventilator, that is invasive ventilator. In that pressure mode and volume mode too. So in pressure mode, PCV and PSV. PCV means pressure control ventilation, PSV pressure support ventilation. Volume mode, there are four mode: AC control, CMV, that is continuous mandatory ventilation, IMV intermittent mandatory ventilation, then SIMV synchronized intermittent mandatory ventilation, and it is used with sometime with PSV, that is pressure support ventilation. So that's why it is known as sometime combination mode also. Then we see non-invasive ventilator. In that positive pressure and negative pressure two type. In positive pressure there are two mode, that is CPAP and BiPAP. CPAP and BiPAP, that means continuous positive airway pressure. BiPAP, that is bi-level positive airway pressure. Then negative pressure example is iron lung. We see negative pressure ventilator, that means it is used very rarely. Okay, nowadays it is not useful. Then it resemble normal lung mechanics, via the negative pressure can generate into the one tank. Okay, See in diagram, the patient is in the tank and the nurses provide a negative pressure into the machines and it support to patient ventilation. Then positive pressure ventilator, that means it moves the positive pressure into the patient's lung and it provide a support to a ventilation. At the end of inspiration, the ventilator stops a delivering positive pressure and it is most commonly used nowadays. Thank you.